on the station that's on your side. This is Channel 7 News Daybreak.
The time now is 6:23. How many times have you heard the advice of taking a daily aspirin? Well, a new large study just released says that a daily aspirin may actually be harmful for healthy older adults. So should we stop the aspirin? Well, joining us this morning is Baptist Health's Dr. John Allen Cockerell with Sherwood Family Medical Clinic to explain. Good morning to you. Thanks so much for being here.
Good morning. Thank you.
Let's start out with aspirin is again in the news this time. A new study saying we maybe shouldn't take it every day.
I feel like aspirin is always in the news.
Yeah.
You know, is it good? Is it bad? Should we take it? Should we not take it? Kind of goes back and forth. Thoughts have changed over the years, really. And this study that you're referring to, we'll get into, is a good study. It's from the New England Journal of Medicine, you know, but it kind of calls into question the need for aspirin in older adults. So this is kind of the next iteration in that discussion on aspirin, you know. This study really looked at age 70 years and older.
Okay.
People that had never had a heart attack or a stroke before, and they were trying to prevent the first one from happening. Didn't show that it was really effective in that, and actually showed that there were some side effects, specifically GI bleeding, that was associated with it. So again, it kind of calls into question the need for aspirin for older adults in some cases.
Okay, so what does this mean for maybe viewers out there that are sitting at home watching saying, I'm on a daily aspirin?
Exactly. So yeah, I mean, it begs the question, right? If you're 70 years old at home and you're on aspirin, you know, should you stop it, right? Is that, well, hey, he said, you know, it's going to cause GI bleeding. I probably should stop this, right? Before you do that, please talk to your doctor, right? And I'm not trying to pander there. I'm serious, because there are indications for aspirin's use, you know, that have been well studied, and we'll get into one in just a second. But before you make any changes, please let your doctor know.
Okay, so those things that we do need to take aspirin for, and there are some people that do need to be on aspirin.
Sure, yeah, and I think on your screen just in a second here, there's going to be a few things to look at. This is an example of what an aspirin indication is, and a couple of things here. One, it's pretty detailed, right? So there's some stringent guidelines behind who gets aspirin, who does not. You can read them along there on your screen. But this is proven to be effective in people. This is coming from the USPSTF, which is kind of a mouthful, but it's a government watchdog that looks at prevention and tells us docs, hey, you know, treat your patients with these aspects. So if you'll see there, if you meet all 5 of those criteria, then maybe you should be on aspirin. Okay. The ASCVD risk score there at number 2 is something your doctor calculates on your behalf. If you have any questions, you know, please talk to your doc. If you have a study that you want to bring up, especially with me and Sherwood, whatever, you know, you're one of my patients up there, come on in, bring it in, we'll talk about it.
Most doctors are willing to discuss this and really kind of tailor things to who may need this and who might not.
Sure, yeah. Absolutely.
Good stuff as always. Dr. Cockerell, thanks so much for being here. If you have any questions, you can always call the Baptist Health Helpline at 1-888-BAPTIST. That's 1-888-BAPTIST.